Good afternoon. This is Cameron Fowler. I'm the Continuum of Care Director with the Texas Homeless Network. I just want to thank you all for joining us for our webinar today, a boot camp on ending veteran homelessness. We really appreciate your time and hope you will get a lot out of this webinar. I know our staff put a lot into it. Just housekeeping real quickly before we get started. Wanted to remind all attendees, you can either raise your hand to ask questions or type them in the chat box. And you can ask questions as we're going through the webinar. When we do our Q&A session at the close of the webinar, we'll be going through all those questions. And any that we don't get answered, we'll get back in touch with you on those. And also want to let you all know we'll be providing the PowerPoint from the webinar as well as the recording to all attendees, and we'll be posting it on our website as well. So thank you again for joining us. As I said, my name is Cameron Fowler. I recently joined the Texas Homeless Network as the Director of Continuum of Care. We serve as the COC lead for the Texas Balance of State. That includes 216 counties and over 87% of Texas's landmass. We know we have lots of our community partners and grantees on the line today. Thanks for joining us. The Balance of State's been doing really critical work on ending veteran homelessness very closely with our SSVF partners, and we're now working to move on to work with individual communities along with veteran-specific resources towards the goal of functionally ending veteran homelessness in the Balance of State. And as you all have as well, we've really seen what can be accomplished and achieved through partnerships with state, federal, and local governments, faith-based resources, business communities, and nonprofits, and really feel like it's a testament to what we can achieve not only as communities, but as a nation with clear goals, resources, and really staunch community efforts. And that is what we are going to be talking with you about today. In the Balance of State, we also view this initiative as an opportunity to really show how we can effectively end homelessness with other subpopulations. So using this effort to be successful with other subpopulations just based on the importance of systems change, including coordinated entry, prioritization, and really effectively redesigning our homeless services system. So today we have some fantastic guests. We're just really thrilled are joining us today. We're going to have remarks from the from the United States Department of Housing and Urban Development Regional Administrator Tammy Trevino. We also have with us Bob Polster from the USICH Council on United States Interagency Council on Homelessness. Bob's a regional representative and covers the Balance of State. We're going to be doing an overview on ending veteran homelessness, key strategies to success, and we'll also have remarks from Sunny Shaw about ending veteran homelessness in Pocatello, Idaho, and then we will be answering your questions. So again, our guest speakers are Tammy Trevino from HUD, Bob Polster from USICH, Sunny Shaw, the Executive Director at the Housing Authority at the City of Pocatello in Pocatello, Idaho, and Kelly Barker with Apt Associates. And on the call, you have myself. I've introduced myself already. Sophia Cheka, our Systems Change Coordinator, and Caitlin Bear, our Continuum of Care Programs Coordinator. And I'm going to share with you all a little bit about Tammy Trevino from HUD, and then I'm going to turn it over to her. Tammy H. Trevino has been the Regional Administrator for HUD Region 6 since August of 2013. As the Regional Administrator, she oversees the administration of all the HUD programs in the states of Texas, Oklahoma, Louisiana, Arkansas, and New Mexico. Quite a large job. She has more than 25 years experience in managing housing and economic development programs for underserved populations. And prior to her work with HUD, Ms. Trevino was the administrator for housing and community facilities programs in the U.S. Rural Development Agency. And there she managed national loan and grant programs for housing and community facilities to help rural communities and individuals. Tammy has an MBA degree from Sul Ross University's Rio Grande College in Uvalde, Texas, and a BA in communications from the University of Texas at San Antonio. Her passion continues to be in providing housing opportunities to Americans who need access to affordable housing. Tammy. Tammy, you are muted. You need to unmute yourself. There we go.
How about that?
There we go.
There you go. Thank you so much. Thank you, Cameron. Sorry for that little glitch. My thanks to all the panelists that will present today and to all of you, the attendees. If you hear nothing else from me today, there are two things in my travels around the region and in working with folks who are working with ending veterans homelessness. One of them we started emphasizing back in September, October, and that is, yes, we're getting to the end of 2015, and yes, we've come to a ending veterans homeless by 2015 time frame, and we know it's passed. But there are many communities that have not gotten there yet, and my response to you is don't let up. Don't stop. In fact, there are many, many communities, especially in Texas, who are seeing the good work that's being done across the country and are seeing the positive impact that ending veterans homelessness has had on those communities, and they want to join in. We still have mayors raising their hand to join the Mayor's Challenge. So don't stop. The work continues to grow. One of the second thing I wanted to say is one of the very biggest advantages that has come out of ending veterans homeless challenge has been the ability to bring communities together to work together. You've heard for years that it takes a village to raise a child. It's going to take entire communities to end homelessness. There's not one COC that's going to do it alone. We're going to need all of you. We're going to need all the partners. And as you continue to go out into your communities to do the work, remember the words coordinated entries, because that's going to make a huge difference. Making sure that all your partners are on the same page, and making sure that when you start identifying your veterans that are homeless, that you start identifying them by name, because boy, that person becomes a real person to you rather than just a number. These are just two observations that I've made in working with communities, and I just want to say that the United States Interagency Council on Homelessness, the Veterans Administration, HUD, the White House, we're all committed to this, and we're going to stay right behind you. We're going to continue to put in the resources that Congress gives us to make sure that we continue to help you meet your goals. We're going to continue to work closely to make sure that all our partners and all our communities have all the tools and the resources that you need to get to where you need to be. Please remember, we're there with you and for you. Thank you for having me.
Tammy, thank you so much. I have to say, I know none of us can see each other, and this is one of the interesting things about webinars, which we use quite frequently here at the Balance of State to communicate with all of you out there, but we're all, and I'm nodding our heads and silently cheering. Just we appreciate your words. You know, we are one of those communities, one of those very large communities that is not there yet, but we are absolutely dedicated and just are incredibly appreciative of the support from all of you on the call today and all of the resources we know are out there, and we are not stopping, and it really helps to know that you all are behind us. So thank you, Tammy. Next, I would like to introduce Robert Polster. We know him as Bob, our USICH regional representative. Bob is, again, the regional coordinator at USICH, and one of his coverage areas is Texas. Bob has directed the Division of Housing Stabilization for the Commonwealth of Massachusetts, funding a statewide system of family and individual shelter programs, as well as shelter division and rehousing programs. He spearheaded efforts to transform a system that relied on shelter as the primary response to homelessness to one that offered a range of flexible resources to prevent homelessness and provide rehousing assistance. Bob has also served as executive director of a variety of community agencies in the Boston area, and we are thrilled he is on the call with us today and are excited to hear from him. Bob?
Well, thank you very much, Cameron. Appreciate Pin Valley being on the call as well. You know, when I think of Texas, you think of all the cities in Texas, but if you're in the homelessness world, you also think of the Texas balance of state, because it's such a large swath of geography that covers the state of Texas. So I'm just really happy to have this opportunity to speak with all your partners today. My region is Region 6, it's a federal region. It includes Texas and Louisiana, as well as Arkansas and Oklahoma. But this year particularly, I can see a real divergence of interest and commitment to work with Texas, and particularly the Texas balance of state. So I hope this is the first of many opportunities I have to work with Texas Homeless Network and Cameron and Eric and the great team there, but also the partners that are on the call representing the Texas balance of state. So I'm also happy to bring regards from the United States Interagency Council on Homelessness. As you know, we're a small shop in Washington, D.C. That works primarily on policy out of the D.C. office, but we also have national initiatives teams that work with communities across the country. And that's kind of where my position rests, where I can support not only Region 6, but Region 7, which is the Great Plains states, Region 1, which is New England, and Region 2, which is New York and New Jersey. So I have a lot of experience working with communities all across the country. And as a matter of fact, many of my communities have really worked hard and have been able to achieve the goal of ending veterans homelessness. I've worked a lot with the folks in Houston, Texas, also the folks in New Orleans, but also in a lot of the other 23 jurisdictions that have been confirmed with ending veteran homelessness. 2 of those are states, the states of Connecticut and also the Commonwealth of Virginia. So we're seeing great momentum in this effort all across the country. And as Tammy said, December 31st was not a deadline but a target, and so we're continuing to push forward even more aggressively now in the last year of this administration to support communities to do the kinds of system transformation that's really going to take us to the finish line on veterans, but will also set us up to make great progress on family, youth, and chronic individual homelessness. So I'm happy to do everything I can over the next several months to support you in building that kind of system that's going to achieve an end to veterans homelessness across the balanced state, because that is going to be the foundation where we're going to continue to work to end all homelessness in this country. I really firmly believe that. And I've seen the system transformation happen in communities. And one of the things that I've noticed, it takes strong leadership in communities. And so we would work with you to enlist your jurisdictional leaders, whether they're mayors or county officials, or any other champion within your jurisdiction that can really help bring the right folks to the table to make this happen. So we know that leadership matters, and so we'll work with you on that, and I'm sure you've already identified your local leaders. But the other thing that matters when we do system transportation is that people come to the table with their sleeves rolled up, really ready to look at a system model of how we can end homelessness. And on many levels, that is not business as usual, as I know you have come to learn. It really does mean kind of stepping out a little bit more and understanding that in order to really make this happen, my agency is going to need to be flexible. I'm going to need to do things that may be out of the box, but are going to help us achieve the goal. When you think about it, there's not any one agency that has a mission to end veterans homelessness. There's a lot of wonderful community-based organizations out there that have missions that don't necessarily say end veterans homelessness. So when we build a system and we have a group of leaders, it becomes their mission to end veterans homelessness, and it's a coordination and collaboration among many different partners. So I really just want to encourage you to think about system transformation and how you come together to do things that you may not even have anticipated doing together. It may mean working a morning or an evening to go where the veterans are stationed. It's all sorts of things that folks, I particularly remember the individuals in New Orleans talking about how they really had to change their perspectives, but how transformative it was not only for them in the community space, but also personally, how rewarding it was for them as individuals, social workers or organizers or housing agency folks, to see a goal and achieve it in a very coordinated and collaborative way is very powerful. So the federal government is here to help. Tammy and I are partners in this, as is the VA, and Heloise Ferguson is the Visit 17. Visit is Veterans Integrated Service Network leader for the most of the state of Texas, with the exception of Houston, Harris County. So Heloise is on board. And also Tamara Wright, who's the regional coordinator for the SSEF programs. And I know you all know Tamara because she's doing a great job in that area as well. So you've got your federal partners there. And as you probably know, there's a template that you would submit for your jurisdiction when you feel you have achieved the criteria and benchmarks that are outlined by the federal government, which I'm sure will be discussed on this call today. The criteria and benchmarks are nothing more than a vision statement about what it looks like in a community to end veterans homelessness. So I think if you look at it as what is the vision of how we make this happen in terms of outreach and engagement, access to housing, and then retention in housing, and how effective that system really is in moving veterans into housing, and that's what we call our benchmarks. Criteria sets a vision, the benchmarks kind of set some measures which you can use to determine how well that system vision is functioning. So if you think of it on those two levels, criteria being the vision and the benchmarks being the measures that you use to really judge how your system is operating, I think that's an easy way to think about it. And when you begin to think about how you develop these kinds of efforts in your own communities, it'll be helpful, I think, to think about it in that frame. I also want to say that this has been a huge effort by the Obama administration, and the First Lady Michelle Obama particularly has stepped up in her role as co-chair of Joining Forces, and as you know, has done incredible work to support your efforts. I hope many of you have seen the video that she did, which was an outreach to landlords video, which I think you can use in your work when you have any challenges reaching out to landlords. And then in addition to that, the USICH has a web page that you can search for, and there are fact sheets, webinars, and just successful strategy documents that you can use to do the work in your community. So I'm happy to be on the call and be your partner. I'm going to be on the call listening to the conversation and able to offer any input or support as I can. And I just want to thank you all again, and how proud we are of the Texas Balance of State to be working with you in this effort. Thank you very much.
Thank you so much, Bob. We, again, I know you all can't hear or see, but silently cheering and are just so appreciative of your support and comments, and absolutely know that our partners and communities and agencies, programs are going to be willing to really step out of their comfort zones and take some risks, and we want to be there to support them through this work. And also just your emphasis on local leadership is so crucial to this effort, you know, regardless of where it's happening, but especially with the geography we're dealing with, we rely so much on local leadership and community planning, you know, including all those that you mentioned, and also our local homeless coalition. So just thank you again. I know I've appreciated so much being able to have regular communication with you since I started here. And we've been lucky enough this week and last week in Austin to have both the First Lady and the President here visiting us for different reasons, but we're still thrilled to have them. So just thank you again, Bob. And just to remind everyone, Tammy and Bob will be available for questions at the end of the call. And I am going to now pass this on to Caitlin Bear with THN, our Balance of State Continuum of Care Programs Coordinator.
Thanks, Cameron. So hi, everyone. As Cameron said, my name is Caitlin Bear. I am the Balance of State Programs Coordinator. I work with the Supportive Services for Veteran Families grant. You'll hear me call that the SSVF grant. I've also been working in depth with our COC programs and in a more limited context with our ESG programs. So today I wanted to provide you guys with a little bit of context for where this initiative is coming from. I looked at our registration list before we started the webinar today, and I saw a lot of my SSVF grantees there and some VA folks. But there's also others who are on the call today who may have less context for where this initiative is coming from. So we wanted to lay a really firm groundwork before we start talking about strategies so everyone can be on the same page and really absorb these strategies to the best of everyone's abilities. So why are we focusing on ending veteran homelessness and not other types of homelessness? Homelessness isn't an issue that only touches veterans. It's a much bigger issue. So why are we focusing on veterans? And there are a number of reasons for why we're choosing to focus on this specific subpopulation. For one, I don't know if I need to pull at anyone's heartstrings, but we have a duty to serve our veterans. They are people who have written a blank check to this country and who are willing to put their lives on the line to defend us and our American way of life. And it is sad, to say the least, to have them come back and see that they are not taken care of in the same way that they take care of us. The second reason is that it is a federally endorsed plan. And Opening Doors is a plan that the Obama administration put forth to end all kinds of homelessness. The first issue of which was ending veteran homelessness. As Tammy and Bob mentioned, they set the deadline to be 2015. They wanted veteran homelessness to end by 2015. And we haven't quite met that mark. But as Tammy said, that's not a reason for us to stop trying. If anything, that's a reason for us to build even more urgency to get it done even sooner. And so that's why we're providing this webinar, is to help give you guys the tools and the context to move forward with a great sense of urgency, because we want to end veteran homelessness, or any kind of homelessness at all. We have to start somewhere. Another reason why we chose veterans to start with is that veterans have an unprecedented amount of resources. So they have their own healthcare system. There are specific work-related employment resources that veterans have. Obviously, the VA is a wealth of resources that other populations at this point don't have. We're hoping that we can show that through veterans' use of these systems that they are effective and that they are needed for other populations as well. Which leads me to the last reason why we're choosing to focus on one subpopulation, and that's systems change. We're looking at redesigning how we approach the issue of homelessness to be a community level approach instead of an agency by agency approach. We're not going to end homelessness of any kind working alone at our own individual agencies. We really have to start working together. And in order to do that, it's helpful to pick subpopulations. So with veterans, they are folks that have great resources. Not only is the Obama administration supporting us in doing this, but they're a great population to pilot a new system approach on. So I know that Sophia will be speaking a little bit later about what systems change really means, but we'll be using this population as a way to pilot a new way of approaching an end to homelessness. So how are we going to get there? How will we end veteran homelessness? It's going to take a lot of hard work and change. Change is always difficult, no matter if it's change in your personal life or even agency-wide. It's never easy, but it will be worth it. And we're trying to give you guys as much support as you need to make sure that we can make the necessary changes in our approach and in our communities to come together and end homelessness. We'll also be providing a lot of education on employing the key strategies to success. One of the ways we're providing education is through this webinar. Later, Sophia and I will be speaking on direct service strategies and planning strategies that you can use in your community. We're going to be sharing some of the most successful strategies that we've been able to find through our research to help you understand what other communities are doing that you might be able to replicate in your community. There are a lot of resources online currently and through your TA providers that you may have that are specifically geared towards ending veteran homelessness. So now is really a great time to start because there is so much support out there that we would like to be able to harness that. And then lastly, we know that many of you have the will to make this happen. And where there is a will, there is a way, and we will help you make this happen for your community. All right, so now I'm going to hand the mic over to Sophia, our systems change coordinator, to talk a little about what the Texas Balance of State Continuum of Care has done to end homelessness thus far.
Thank you, Caitlin. This is Sophia. As she mentioned, I'm the systems change coordinator, and that's a fancy way of saying that I deal with everything coordinated entry related. So I'm your person to talk to if you're interested in that process. We just wanted to give everybody some background about what we've been doing in Austin in terms of ending veteran homelessness and to provide a little bit more structure to communities within the balance of state. The first thing that we've done is we've developed this continuum of care, or COC-wide definition. We've been working with our supportive services for veteran families, or SSVF grantees, for probably 1.5 to 2 years. We've been doing really robust work for them, with them during that time. And what we have been finding recently, as Caitlin and I have been working more and more in this effort, is we didn't have a standard definition for what it meant to end veteran homelessness. So when we were getting our community plans back from the communities that have SSVF funding, we were finding that every definition was slightly different, and our concern was the cohesiveness of that. So it would be very hard to declare that we have effectively ended veteran homelessness in the balance of state if everybody has a completely different definition, let alone that would be an administrative nightmare. And so what we did recently is we put together this definition. It is taken from the US ICH definition for ending homelessness in general. And we've also included the fact that we will be using the United States Interagency Council on Homelessness criteria and benchmarks to measure communities' progress towards that goal of ending veteran homelessness. So this is our COC-wide definition. We'll be sending it out on a pretty letterhead later on when we send out the recording. I do also want to say that this definition went through various, what we call the multi-prong approach to approval. We presented it to our SSVF grantees. They provided feedback. We then presented it to our representative planning group, I believe a couple of weeks ago. Everybody said it looked good. I don't think we got any feedback.
Oh, we got a couple of comments saying that, yes, they liked it.
Good.
Yes.
And then our last step is getting our Continuum of Care board approval. They had a meeting last week, and the final vote will be happening tomorrow at 5 p.m. We're not expecting any huge changes to the definition. We're actually expecting that it be adopted. So this will be the definition for what ending veteran homelessness, and therefore what ending all homelessness, is in the balance of state. And then the next thing I wanted to talk about before we get into the meat of this webinar is how THN can help. So we are really here to be y'all's thought partners. I know in the past that the support that we have provided has been lacking. And what we're really trying to do is to be partners with everybody and to really support you all in ways that you identify rather than in ways that we identify. So we can help in all areas of planning resources, advocacy, education, and these are just examples of what those things mean. If you are interested in taking us up on our offer for assistance, the best way to get assistance is to contact us, is to email Caitlin and myself and say, hey, we want to do this. This is how we have identified you guys could be most helpful. We need somebody to reach out to our mayor. We need somebody to reach out to a local funder. Can you please assist us with that? So the best way for us to help is for you all to let us know how we can help you. If there is no communication, we can't do anything. So please, I encourage all of you as we go through this that if you identify areas that you need assistance to, please email us. As we go through this process with various communities, we are learning more and more, and I think we're getting better and better at it. And so we believe that it is possible. We know that the will is in every community that we're working with, and we really want to be partners with you all. So now I'm going to get into why you guys are on this webinar. So we have broken down the key strategies into 2 different categories. So the first are planning activities, and then the second are direct service activities, which Caitlin will be discussing later. So the first one is leadership and commitment. So as it has been alluded to as it has been discussed several times, leadership is truly key to this process. Last year, when the webinar for how New Orleans ended veteran homelessness came out, it was very clear that the mayor was instrumental in making things happen in New Orleans. And leadership may look different ways in each community. It may be one champion. So for example, in Longview, we have Randall Webster, who approached us and said, I want to do this, let's make it happen. And then we helped him. And so it could be a task force. It could be one local leader who decides, I think that we can do this. Can you guys help us? And let's create a group of folks that really focus on this and getting key stakeholders to the table, which I'll talk about on the next slide. But it's really important to have clear leadership on the ground so that you can really drive this goal forward. It's really hard to make something as grand as ending veteran homelessness happen if nobody is the leader, if everybody is a follower. And political leadership can make a huge difference. Your mayors can make amazing things happen, and I'm really excited for you all to hear from Sunny Shaw, because it's in that instance, the mayor was instrumental in a lot of respects to making things happen in Pocatello. The second is partnership and collaboration. So I, through my work with coordinated entry, did a lot of traveling my first 2 years here, and I saw a lot of partnership and collaboration happening, but ending veteran homelessness requires almost hyper partnership and collaboration. It really requires that agencies are speaking to each other. As Tammy mentioned, I believe, they're speaking about the same people, they're using common languages. I'll be talking about using a common assessment in a little bit. And that they're using the same data system to gather all of this information and make decisions. So it's really important to develop partnerships where there are none. So maybe you need to reach out to local landlords or to nurture relationships that are already created. You'll see here that I have examples of key stakeholders in this process. The continuum of care, as I mentioned, we really want to be thought partners. We really want to be at the table as much as you want us to be. The local homeless coalitions, we think of them as extensions of the balance of the COC. And so it's imperative that the local homeless coalition be involved in this process. The Department of Veteran Affairs, because of the unprecedented, or because of the variety of resources available, as Caitlin mentioned. In communities that have SSVF, or even in regions that are covered by an SSVF grantee, I highly encourage you to invite them to the table. They have a lot of rapid rehousing and homelessness prevention money that can be utilized. Your public housing authority is also key. I know we're starting to have conversations with some of them about developing a homeless preference, about using the VI-SPDAT to prioritize who gets a HUD-VASH voucher. Your local government, as I mentioned before, mayors can make things happen. And then ultimately, last but not least, local providers in your housing crisis response system. What I mean by local providers are not just housing providers, but anybody who touches a homeless person, anybody who interacts with an individual experiencing homelessness. It's really key that you invite all of these people to the table, because they will be offering varying viewpoints that other providers may not see. So, and I also want to say, this isn't the end-all be-all list. I didn't include landlords, I didn't include businesses, I didn't include, I mean, I can think of schools, so many. So this is not an exhaustive list, and try to be creative with the people that you decide to invite to the table. This next strategy is housing first or lowering barriers. And what I mean by that, so housing first is both an approach, but it's also a model. So housing first as a model is based off of Pathways to Housing and Sam, I always butcher his last name, Sembris. I have a Dr. Sam Sembris, thanks Cameron. And the idea with housing first is that in order to end homelessness, you have to provide housing first. I'm not saying it's housing only, it's housing with robust resources. But the idea is that somebody cannot concentrate on other issues until they have housing. So the first focus is housing. Housing first as an approach is lowering your barriers. So making sure that your program, your resources are available to people and are not intentionally or unintentionally crowding people out of the system. I think this has in part resulted in our large numbers of chronically homeless individuals. So our recommendation is, as a local homeless coalition, as a provider, as a community, to decide that housing first is the way you guys are going to do things. So no providers will come into our system if they don't have a housing first orientation or are not cognizant of basically roadblocks in place to eligibility or to obtaining resources from communities, partners. So housing first is the way to go. Lowering barriers is the way to go. I know that in our RPG meetings, we've been talking about lowering barriers. We're trying to really start that conversation and continue that conversation. And so we're really excited to hear from folks about how they're doing that. And I think the thing that most excites me from a systems change perspective is that communities or agencies in particular are looking at their processes for how they can be streamlined to be more client friendly. And then this is my favorite thing to talk about, is coordinated entry. Coordinated entry, so much can be said about it. And how I like to define it is coordinated entry is essentially systems change. So you're looking at your processes both internally within agencies, but also system-wide for how it can be more coordinated and client-friendly. So I'm going to move to the next slide because I think it'll help explain it better. So the graphic on the left is a system without coordinated entry. I think a lot of you will know that your system looks like this. When I worked in East Oakland on homelessness prevention and rapid rehousing, our system very much looked like this. And through coordinated entry, which is, as HUD defines, this idea of coordinated entry, so you have designated entry points where people are referred to so that they will get assessed, that's another piece, assessed in a common way. In a lot of communities, it's using the Vulnerability Index Service Prioritization Decision Tool, a Decision Assistance Tool, or VI-SPDAT, and that's what we are utilizing in the balance of state. We're assessing everybody in the same way so we can, as I mentioned earlier, speak that same language and then make appropriate referrals. So when I worked in Oakland, and I'm not proud to admit this, but I was very unfamiliar with what the system was like. It's a very large system. I didn't get a lot of training. And so what would happen a lot of the time is we would assess somebody for rapid rehousing. They were ineligible, and so I'd hand them a flyer and say, here you go. These folks may have assistance, but I don't know. And so a system with coordinated entry is stopping that. We are only making appropriate referrals of clients to interventions that are appropriate to end their housing crisis. So it's a simplification of the current system as we know it. If you have more, I could talk about this for like 3 hours. So if you have more questions about this, please contact me. Coordinated entry can sound like a lot, but if you remember that it's systems change, it's analyzing all parts of our system to make sure that it's client friendly and people are moving into housing as quickly as possible. I think that's the best thing that I can tell you today. And then tying into that is optimizing our resources. So the idea behind optimizing or leveraging your resources is how can we braid together resources to get people into housing quickly? So when it comes to veterans, as Caitlin mentioned, there are a lot of resources available. We're doing some VI SPDAT data analysis for our coordinated entry pilot communities. And what we're finding is that overwhelmingly the majority of veterans have honorable discharges, which the good news about that is they can get served by SSVF. However, there's about 5% of folks that have dishonorable discharges who cannot get served by SSVF. So conversations that are happening in communities is what other resources can we utilize in order to house this person, because we can't use what's designated for veterans. So it's really thinking creatively about what's available in your community and how you can utilize all those resources together. We can't do it alone. What has been found in communities that do hyper collaboration, especially when it comes to like putting their money together, is that they often see the most bang for their buck because they're using their money in a very strategic, coordinated way. And then the other thing is expanding your housing options, So I am a huge proponent of housing navigators and using them to do landlord outreach and to really develop landlord relationships to build housing stock. And so it's really important to think not so much about what you don't have, but about what you do have. I think that's the key thing that I've seen in a lot of communities. It's really easy to say, we don't have PSH, we don't have this. Well, what do you have? In some communities, we have HUD-VASH. So that's why we're having conversations about, well, one, if your PHA doesn't currently have HUD-VASH, how can we get it to your PHA? But also, if you do have vouchers, how can we use them as PSH? How can we use those creatively? Because it takes a really long time to create PSH. So I think what I love most about this whole process and about systems changes in general is that HUD is allowing you guys to be creative. They really, really are. They're allowing you to take some chances and to serve people in different ways than you've done it before. And so I really encourage you to really seize this opportunity. This one, and I'm also a huge data nerd and love talking about it all the time, data is king. Data should be driving everything that you guys do. So I actually found this through like a casual Google search, and I thought it like perfectly encompassed what it means to be data driven and make data driven decisions. It's really gathering your data, and I think a lot of us do this really well. We get our data in HMIS and we get really good data quality reports back, but that's usually where the buck stops. And I've been doing HMIS for a long time, both as an end user when I was in Oakland, but also as an HMIS trainer when I was with the Austin Continuum of Care. And I've seen this time and time again. We're really good at gathering the data. We're not so good about kind of the other three things, which is interpreting the data. So what is it that this data is telling me? What can I do to address what this data is telling me? And then how do I create this change in our system? And I know we're asking you guys to do something different than has ever been done before, and I know there are varying degrees of data literacy, and that's why we are here to help you. We are here to help you guys make decisions based off of data rather than anecdotes. So I want to give you an example. So as I mentioned earlier, we've asked our coordinated entry pilot communities to do VI SPDATs with veterans during this year's point in time count. And this is a summary of the ideal housing intervention. So when you do the VI SPDAT, it's based off of 4 domains, and each domain gets a score, and then obviously there's a total score. And you'll see what the total scores mean on the left-hand side. What this is telling me is for those 27% of folks that were assessed, or those 4 people who need no housing intervention or need some type of non-housing assistance, these folks are probably your your greatest candidates for homelessness prevention or diversion. And so going from there, so seeing this data, I can then say, okay, well, how do we employ diversion within our community? How do we get more prevention resources in our community, knowing that we have none right now? And then for 9 folks, or 60% of those assessed, rapid rehousing and or transitional housing is ideal. There are a lot of communities where we do not have any rapid rehousing. So knowing this data, how can we get more rapid rehousing in our community? How can we get local funders to fund a demonstration project? How can we reach out to a collaborative of agencies to pull some money together to practice this? And then for 2 or 13% of those assessed, supportive housing is ideal. And as I mentioned earlier, we have very limited permanent supportive housing within the balance of state. So how can we be more creative in developing that? How can we use How to Bash? How can we utilize landlord relationships? That kind of stuff. So I'd be more than happy to talk with y'all about this some other time. And then ultimately, in regards to planning, I think a key strategy is urgency. So we've been working a little bit with Longview, and 2 weeks ago, I believe, they set a goal that they were going to end veteran homelessness by the end of June, right? Yeah, end of June. And so it was interesting to see kind of the tone change between that meeting and the next meeting, because everybody's very aware that it's happening and we need to move forward. So using your data, and that's what we did with Longview, we looked at their data and said, based off of your data, you can end it in 3 months by housing 5 people, you can end it in 6 months by housing 3 people, you can end it in 10 months by housing 1 person a month. And so using their data to determine when that deadline is key. But the important thing is that you're creating that deadline, because I think the New Orleans webinar was really great in really hitting home this idea of urgency. This sense of urgency really got everybody on the same page and understanding that they need to work, and they need to work hard, and they need to work now. So creating this deadline is truly key to this process. And now I'm going to hand it over to Caitlin. And don't forget, if you have any questions, to put them in the chat box, and Kelly Barker will be fielding them later.
Well, thank you so much, Sophia. Systems change can be really, really hard. And so looking at those planning activities, it's really easy to get overwhelmed or think that you've been doing something wrong over these past 10 years, you've been ahead of your program. And we just really want to emphasize that we're so proud of all of our balance of state programs, and we're not telling you you're doing something wrong by not having already done this. We're just asking you to do something new and something different. We're asking you to take a chance on this strategy, and that we're going to be here for you every step of the way as you're making these really tough changes. So I just wanted to follow up with what Sophia was saying, and that we understand that this is really taking a system that maybe some of you have been working with for years and turning it on its ear. And we're going to be with you every step of the way to help you with it. And we do realize that we're asking you to do something very, very different. If you're willing to take that step with us, we think we're going to see a lot of really positive changes. What I'm going to talk about are direct service activities. So these are some innovative strategies that you can take back to your frontline staff as you're working directly with veterans. No one has solved veteran homelessness by sitting in an office. Although sitting in an office can be valuable, not to devalue what Sophia just said, it's a great place to start, but that's not the end of the conversation. At the end of the day, we need to go out and find these veterans and talk with them and eventually house them, or hopefully sooner rather than later house them. So these are some strategies that you can use with your frontline staff that other communities have found to be effective. So the first step in any service program is to find your clients, outreach. Many of you probably have outreach teams in your agencies that go and find individuals that are in need of your services. These are some strategies that other communities have used to enhance their ability to find a specific subpopulation, and that's veterans. So the first is to proactively seek out homeless veterans in need of assistance. I know a typical model, or sort of the old model of doing outreach is maybe you go to a couple of target places, but mostly you would wait for veterans to call you or walk into your office and say that they need help. What we are advocating is that you go out, that you try to find these veterans in a very intentional way, and that you not only look where you think that they are, but that you coordinate with other agencies in your area. So get your outreach workers together, not just from your agency, but from the other agencies that are in your area. Have your outreach workers talk with one another about where they tend to find veterans, because there may be an agency, even across the street that can share that knowledge with your agency, so that way you guys can have more robust coverage. You can even work with, the veteran justice outreach person at your local VA, who might know where veterans exit to out of jails. Really, the more people that you can talk to and have at that meeting with your outreach workers about where veterans are most likely to present, maybe it's in hospitals in your community, then you know where to target your outreach to. But you're not going to know that if you, just stay siloed and stay in your own agency. It really takes a coordinated plan. The next part is about publicizing veteran intake locations, widely amongst providers and public. So what I mean by veteran intake locations is that as we're doing systems change with you, there may be certain agencies that have trained staff to administer it via SPDAT, or who are holders of what's called a master list, which I'll get into in a little bit. And if there are only certain agencies that are accepting or that are doing the veteran intake process, other agencies need to know who those agencies are, how to get to them when they're open, and how they can refer a veteran to you. And that needs to be widely publicized so that not only case managers and outreach workers who are not veteran entry folks know where that is, but so that you could put it out in your local library, your hospital, give it to your jail social worker, so that way they know as well. This is something I'm currently working on with Longview, as I'm making them a flyer for their veteran entry points that they are going to put in every conceivable place. An interesting strategy that I actually heard at a SSVF regional meeting is that someone had given some flyers to some sanitation workers in their city, because the sanitation workers would often find people experiencing homelessness sleeping near dumpsters or under bridges where the sanitation workers were doing some cleanup work. And because those individuals had a high instance of finding veterans or others experiencing homelessness, they were able to hand out these flyers to those people as they were finding them. So it really does take a little bit of creative thinking about who is seeing these veterans. I know in Lubbock they have a flyer that they give to their police officers. So as police officers are encountering individuals experiencing homelessness, they can get that person's personal information and leave them at the station. And the SSVF provider goes and picks those cards up from the station about once a week to find out where veterans are staying. So those are just a couple of innovative strategies that you can think about how to adapt to your community. The next innovative strategy I have for you for outreach is to make sure that all the veterans that are identified go on something that's called a by name list. So my SSVF providers will know this really well, but for the rest of you, a by name list is a document that is held by an entity where it has the name of every veteran experiencing homelessness in their community. And the SSVF provider is not the one who identified every single one of those individuals. They work together with their community. So if someone walks into a victim services shelter and that person self-identifies as a veteran, they can call that holder of the by name list and say, hey, we've got a veteran over here. And they add them to the by name list, so you sort of have a working inventory of what your homeless veteran population looks like, how many they are, where they are, and then as Sophia was mentioning, their common assessment score. It also helps to use data to identify veterans, so whether that's pairing with your local VA to ask them to run some names in their system and see if they have any homeless veterans that continuously appear there, or if it's using your HMIS system from other organizations, or using any other data sources you can think of, like your PIT count data, then that would be a great place to start filling out that by name list. And then just to hammer it home, utilizing coordinated entry. This is something you will never hear Sophia and I stop talking about. It is so important that there is a coordinated system for veterans and other individuals experiencing homelessness to make contact with the service system that you have set up in your community. It can really help as far as knowing where people are and what interventions are the most appropriate for them. So this is a picture you'll see at the very bottom in very tiny print of what a by name list can look like. It is an essential tool for evaluating the inventory of all currently homeless veterans by name, like Tammy was saying, in your system. The by name part can be so important because, like Tammy said, it's a real person at that point. If you know what their name is, where they're staying, who their caseworker is, it really becomes a much more real, present, and urgent issue to solve if you have these people's names. It's helpful to maintain the list in real time if possible. So some of the best practices that Sophia and I have heard has either one staff member or a couple of staff members that are dedicated to maintaining this list and who update it daily if they can. It's really essential to have a staff member or a couple of staff members be the champions of this list to avoid duplicative data entry, and so that way the data stays really uniform. And also so that way it's someone's job to look at this list, to manage the list, to look at the data from the list, because until it's someone's mission to make sure that this list is up to date, accurate, and is going to be used as a tool in your community, it isn't very useful. And so really designating someone to be that champion of the list is so essential. You can also use this particular list, which is a template that was distributed by the Vets at Home TA initiative. This template has a variety of different features on it that can help you filter out certain veterans. So if you're looking for just those veterans that were identified in October, let's say, then you can pull out those veterans identified in October. Or if you're just looking for veterans experiencing unsheltered homelessness, there's ways to pull that out as well. We do have other communities that like to use their own template, and that's fine as well. We want you to use what is going to work for you, although I do advocate for using the template because it is extremely useful, especially when it comes to measuring an end to veteran homelessness. It's got a really great tool on it where you can click a button and it tells you whether or not you're meeting the USICH benchmarks, which are data points that indicate whether or not you should make a claim to say that you ended veteran homelessness in your community. You can also use a master list as a case conferencing tool. This is actually something I'm going to talk about next. So, case conferencing. Case conferencing on a community level. I know that within agencies, it's a pretty common practice if you don't know what to do with a client you have on your case to go to your supervisor or a group of fellow case managers and say, hey, I've got this individual I'm working with. These are their needs. I don't really know what to do with them. Can you help? We are taking that to a community level, which of course is going to require an ROI to be signed or a release of information to be signed for each veteran that appears on that list. Sophia and I have drafted a couple that if you're interested in starting this process in your community that we are more than willing to share with you. And you can always adapt it to say, what needs to say for your community to be able to use this as a tool. But where we found it to be really helpful is that you can take that master list, and whoever is the champion of your master list or the designated staff member for your master list can pull, let's say, the folks with the highest vulnerability score off of it that have yet to go through an intake process with an organization. And you can take those 3 individuals and you can say we have a 25-year-old female whose name is Joanna, and she needs housing for 3 people because she's got 2 kids. She's a survivor of domestic violence who can help. And there may be a DV provider sitting at that table that would have an opening at their organization that would be able to take that person in. Whereas if Joanna hadn't shown up at that DV shelter, she would never have been contacted by them. Because we have a more community level case conferencing, that door suddenly opens up for her. And so it's really great to use as far as being able to get community members to a table and then be able to go down that by name list and take down those names and try and get those veterans housed as quickly as possible. Right. So the next innovative strategy I have for you may be a new role for someone in your community. It's called a housing navigator, and I know Sophia spoke briefly about housing navigation. It's a really interesting role for someone to play in that it is not a therapeutic role with an individual. It is a solely housing-focused individual whose job it is to interface with landlords and to help prepare a veteran for housing. And by that, I don't mean that the individual needs to meet certain service qualifications, but that if the veteran needs help filling out a housing application, it is that person's job to sit down with that veteran and fill out that housing application, or maybe help with deposits or application fees, stuff like that. So this is a person that before the veteran encounters housing can help them locate housing or can help them fill out applications for housing. Yes.
This is Sophia. There's an excellent National Alliance to End Homelessness webinar on core components of rapid rehousing housing identification. And the thing I love most about that webinar is it makes a very strong case for why this person needs to be entirely separate than a case manager. Your case manager is focusing on housing stability, and your housing navigator is focusing on getting that person into housing. I think all of our communities know that by adding this responsibility on top of the shoulders of case managers, it is very hard to make grand things happen because they have a lot already on their plate.
And it's great not to mix those two roles as well as far as a landlord perspective goes, because another duty of a housing navigator is to recruit landlords and to retain them as far as their willingness to continue accepting clients from a program. It can be very difficult for a case manager to make that connection because they have a client that they know really well, that they really want to get into this particular apartment, whereas a housing navigator can make contact with that landlord and ask them if they'd be willing to house a veteran in general who is in need of housing without necessarily having someone that they know at that moment who they will plug into housing. So it's someone who can develop that housing stock for you, can forge those relationships with landlords, and then later be able to work with your case managers when they say we have a veteran who they just got their ID, so we're ready to apply for an apartment. We'll be able to instantly or near instantly make that connection for your case manager. So the next strategy I want to talk about are, I guess it's prevention, but there are two main strategies, prevention and diversion. So prevention is assistance that can help a household preserve their current housing situation. So this is someone that currently has permanent housing, but has an imminent threat to lose their housing. So for someone who's currently in housing, but they just got an eviction notice and their landlord tells them that if they don't pay their $300 that they're behind on rent, then they need to be out by next week. If we can help them by providing that $300 so they can maintain their housing, and then if they had lost a job, we could help them with a little bit of employment assistance as well, and then they would not fall into homelessness. So it's important to assess for that whenever you have an individual showing up at your shelter, as if they came from their own permanent housing. I think that's a question we don't typically ask when an individual presents at a shelter. We kind of assume that if an individual presents at a shelter, surely they have no other place to go. When that is not the case for, I think, about 30% of individuals that present at shelters. A lot of them will have their permanent housing, but they think they're about to lose it, and so they'll come to the shelter and will say, sure, come sleep here, without really questioning it any further. So something that can really help you preserve your shelter space, as well as those community resources, is to ask someone where they're coming from. And if they are coming from their own permanent housing, ask them what it would take to stay in their permanent housing, and then be able to follow up by providing those resources, which you can get by partnering with other community agencies. That differs a little bit from diversion. So diversion assists households in finding housing outside of shelter while they get the services from your shelter or from other community programs to help them move into permanent housing. So if someone presents at your shelter and normally they live with their aunt and uncle, and they had a big fight with their aunt and uncle, so they present at your shelter. Instead of saying, sure, stay at the shelter, your intake worker can ask them what happened, I know that Sophia and I have attended a training with Ed Boyd at the Mediation Center of Cleveland in Ohio. And in that particular instance, that fight had been about the individual having eaten all the hamburger meat. And so they got in a fight, and so the individual left. And so they had a phone call with that individual who had showed up at the shelter and their aunt and uncle saying, what would it take for your family member to come back and stay with you until they can, figure things out. And the aunt and uncle said they'd be fine with a grocery gift card to replace the hamburger meat that was eaten. So they got him a gift card and sent him back home. So about 30% of cases for people who present at your shelter can be either prevented from entering homelessness or entering your shelter in the first place, or can be diverted. So maybe that person is still not stably housed and you want to follow up with that person for a different program, but for now they have a place to stay for the night that isn't your shelter, which is really optimum. Because while shelter is great and we're really happy that we have it for those individuals who need it, it is not an ideal place for someone to stay. And so if they can find places to stay on their own, that's better for that individual's health and ability to feel stable and autonomous. So the next strategy I want to talk with you all about is progressive engagement. And that kind of goes hand in hand with what we were talking about before with prevention. It is kind of starting with your lightest touch. So not immediately giving every individual that walks in your door every resource that you have, but instead asking them what they need and providing them with services a little bit at a time. So this is particularly valid when you're looking at people's assessment scores. When you're using the VI-SPDAT, a score between a 4 and a 7 says that rapid rehousing is an appropriate intervention, and for scores that are 8 or above, it states that permanent supportive housing is better better intervention. I'm sorry, not individual. And so if someone scores a 7, and you see that they are appropriate for a rapid rehousing intervention, you start them with the rapid rehousing intervention. And let's say that individual is then really struggling to maintain their housing with rapid rehousing. Because that individual is so close to being an 8 and is clearly struggling to maintain their housing despite all these services that you will progressively engage them in, then it would be appropriate to move them into permanent supportive housing. But you didn't start with permanent supportive housing, you started with a lesser intervention. So yeah, am I explaining this correctly? Okay.
Yeah, lightest touch.
Yeah, lightest touch first. And then that can even go all the way to if an individual presents at your shelter, maybe you don't provide them with, I don't want to say don't provide them with services immediately, but maybe they just need access to a computer, a place to do some laundry, and maybe just a couple of problem-solving sessions with the case manager. They don't immediately need to be input into a program. So I believe the person that invented the VI-SPDAT, or rather developed the VI-SPDAT, Ian DeYoung, recommends that if an individual enters your shelter, you don't provide them with financial assistance for about a week or so while they try to self-resolve. And if at that point that individual is not able to go and find a place to stay with family or to find a job where they can move into their own housing, then that individual is assisted and assessed. The very last part is housing stability. So this is what our end goal is. This is what we're aiming for, is for once we move those individuals into housing, we've assessed them, we've gotten them through the shelter system, we put them in a program. Once we get them into housing, how do we keep them there? And I think this is a big question mark for a lot of programs that are considering taking on a housing first approach, because we are flipping around the order. We're providing people with houses and then following up with services. A lot of people want to know, if we don't consider this individual to be housing ready, how can they be housing stable? And this is huge because, well, let me back up. So we understand where that's coming from, because that is a complete reversal of how the system normally is, where we provide an individual with services, and then because of the skills they've gained, they become housing stable. We put individuals in housing, and then you continuously engage them, where you are persistently, but not pushily, going to their housing, and you are offering them services and offering them your support. And we found that the more that you show up, the greater engagement that you get with those individuals. It's also key to provide tenancy support to those individuals. So maybe it's not a therapeutic outreach that you're doing every time you show up at that individual's place. It's about how to mediate conflict between the landlord and the tenant. It's about helping them understand their lease requirements, or about how to maintain your employment and your apartment at the same time. That might not have been a balance someone has had to strike for a while. So really coming from a tenancy and a housing focus rather than a therapeutic focus with your case management strategies can be very key. And then providing income and employment-related support so that an individual can have enough income to maintain their housing is also very key. All right, and now I'd like to introduce our guest speaker, Sunny Shaw. She is the Executive Director at the Housing Authority of the City of Pocatello in Pocatello, Idaho. She's been in affordable housing for 16 years and has a true passion for reducing poverty and homelessness in her community. In 2015, the City of Pocatello declared functional zero in veteran homelessness due to the efforts of the Housing Authority and its partners on the Mayor's Task Force to end veteran homelessness. And she's here with us today to share what strategies were successful in ending homelessness in her community. So take it away, Sunny.
Thank you. Can you see my slides?
Yes, we can.
Okay, great. So as was said, my name is Sunny Shaw, and I'm the Executive Director at the Housing Authority of the City of Pocatello. And I'm going to talk to you today about our task force that was created to end veteran homelessness. But first, I want to give you a little bit of information about the City of Pocatello itself. We're actually a pretty small city. Our population is 54,350, and our county population is about 83,000. We are a rural community. We have mostly farming and ranching that surrounds us. Our nearest large city is Salt Lake City, which is 2.5 hours, and Boise, which is our capital, which is 4 hours away. So we're a little bit isolated. That presents a challenge for us, and that may be like some of you in Texas as well. Our median income is just over $44,000, and our poverty rate is 17.4. In 2015, our point-in-time count indicated that we had a total of 81 homeless individuals within the City of Pocatello, and that seems very small, and we do believe that there are factors that contribute to that. Mainly, we think it's because of the time of year. As many of us know who work with homeless populations, we understand that they can be migrant based upon the weather, and we see that quite frequently here in Idaho with the homeless, the point-in-time count being in January. Our numbers decrease greatly in January, so our numbers do seem to be a little bit low. In 2015, our veterans point-in-time count indicated that we had 18 homeless veterans. So the mayor accepted the challenge to end veteran homelessness in the City of Pocatello in June of 2014, and he brought together a group of community stakeholders, and he created the Mayor's Task Force. And we recognize that having the mayor's name attached gave us some leverage in the community, but even without your mayor's attachment to your task force, you can still bring together these same stakeholders and work to achieve the same goals. Our stakeholders that are in our community were city representatives, the homeless shelter, the college veteran services, the VA, the Housing Authority, Community Action Agency, County Veteran Services, and SSVF, which is interesting because originally we didn't realize that we had anyone who provided SSVF services when we first started this task force, and this task force is what actually brought that information to light. Ogden is in Utah, so it's across state lines, but they come up and work with our veterans quite regularly, so it's because of this task force we were able to link into that resource. So when we first met, we first decided that we needed to have key ways to identify our veteran population. Already in place, we had the point-in-time count, the Veteran Sanctuary, who works with them quite a bit up at the ISU campus, that's our local college, and Community Action was doing a lot of work with the veterans already. But through the task force, the Housing Authority felt compelled to add an item to our application, and we added the question if the individual had ever served in the military. And that is a little bit different than just asking if they're a veteran, because we found that there's some confusion when you ask people if they're a veteran. They think that that may mean did they serve during a time of war, or did they go overseas? And so in order to eliminate that confusion, we put the question as, have you served in the military? And we were able to identify veterans even just through our application process here at the Housing Authority. We also created a community outreach card and a point of contact card, and I'm going to show you each of those. So this is our community outreach card, and it is small. It's just a business card size. We decided that the most important things that a homeless veteran would need to know is where they could have a roof over their head for the night and where they could get hot meals. And in our city, we are lucky that every day of the week there is a hot meal available, weekends included. So we put that information on one side of the card, and on the other side we put locations where they could get a roof over their head that night. These were made available to the community to be distributed to individuals that they thought might be homeless. And so we did some marketing campaigns to let community members know that these cards were available. They were able to pick them up at City Hall and here at the Housing Authority. And they're nice. They're just wallet-sized business cards. And so as someone's driving down the street, they could even hand them to a panhandler who may be holding up a sign that says that they're a veteran. Because we wanted to direct them to where there were these services so that we could begin to identify the veterans. And so we enlisted the community to help us with that. So that's the first resource that we created. Next was a point of contact card. And so we identified locations where a veteran may go that we may not ever see them. Oftentimes they don't just walk into the Housing Authority and they don't just walk into the VA office. So we felt that we needed to identify them through the locations where they're going. So we created this card and took it to the emergency rooms. The police carry it around in their cars, and it's also at the food banks and the locations where they can get food, their warm meal. So this card, you can see the questions that it asks, and our VA case manager goes once a week, as had been indicated, to pick these cards up from the various locations and then try to make contact with that veteran. These are also taken to the jails, as had been previously mentioned, so that way, as they come across veterans, these cards can be filled out. So these were the things that we did to work on identifying veterans in our community who were perhaps slipping through the cracks and we didn't know about. Next, we decided to talk about barriers. What were the things that were keeping veterans from being able to access housing? Oftentimes, we can do our part by getting them through the VA process and through the Housing Authority process. We can get a voucher in their hand, but then it may be really difficult for them to actually lease up. So we identified the main barriers were application fees, criminal-related activity, and landlords who were just not willing to work with the program. So for application fees, we were actually able to address that with our SSVF partners out of Ogden, and they're able to help us with the application fees. But I will say that also through our outreach, we've had several landlords who have volunteered to work with our program and have waived application fees. So that's been a great success. Criminal-related activity. Through this task force and the concerns about criminal-related activity, we were able to create a veterans court. There's a judge locally who has a strong passion for helping veterans, and he, we can say, gently persuaded many of the attorneys that work within the city of Pocatello to volunteer their time. So they each take a turn once a month, and Veterans Court is held once a week, where veterans who have any type of legal question or need legal help can go and meet with an attorney and get free advice on that issue. And it's not just housing issues. It can be custody issues or financial issues. But really, we put that in place so that they can address any criminal-related issues that may be keeping them from accessing housing. Then we also did landlord outreach. And I'm going to discuss that in greater detail in just a minute, but we feel that we've been very successful with landlord outreach. So we had determined that those were the main barriers that were keeping our veterans from being able to access housing once they had a voucher. One other thing that I'm going to add that is not on this slide, we also felt that a barrier was the lag time between a veteran meeting with the VA and meeting with the Housing Authority to get their voucher. So in order to eliminate that lag time, here at the Housing Authority, we made space, and we actually have an office that our VA case manager works out of. So this way, when he knows he's got a veteran coming in, he lets my intake specialist who works with my veterans know that, and she clears her calendar. he has that veteran meet with him, and then once he's done meeting with him, he walks him into her office. She meets with him. Oftentimes, we're able to get the documentation, issue that voucher the same day, and then that veteran is walking out of the office with that VA case manager to go meet with potential landlords. So we think that that's also been very successful in working to address the barriers, because we felt that the lag time was something that we were seeing in other locations as a really large problem in regards to getting those vouchers leased up. So for our landlord outreach, again, having the mayor give his name to this task force, it really helped. The mayor has a talk show once a month. It's called Calling City Hall, and he hosts it, and he gets to choose what the topic is. We have locally here basically a public service channel that runs on the TV, and it runs just information about our city 24 hours a day. And so this show is the mayor's show. It runs for 1 hour. And so in October of 2014, the mayor had myself, along with representatives from the VA, come and be guests on his talk show. And this show runs live initially, so people can call in and ask questions. We shared information about our program, and this was really an attempt to get the attention of landlords to see if they wouldn't be willing to participate with this program. After the live filming, the shows aired weekly for the entire month, and so we were on once a week for the whole month of October as a form of outreach. Next, the landlord, first we created a newsletter. All of the partners who were involved in this task force wrote an article for this newsletter. And so, for example, the Housing Authority's article was about consider the person. Instead of just saying no to everyone who may have had some criminal history, we asked our landlords to do the same thing that we do here at the Housing Authority. You can issue that initial denial, but then meet with that applicant to see if there's something that you can do to turn that no into a yes. And we had great success with that letter asking landlords to consider the person. Additionally, in that letter, we shared a success story of a veteran who had been homeless and had now become self-sufficient through the help of a landlord who was willing to take a chance on them. So there were about 6 articles in that newsletter that went out. We utilized the Housing Authority's landlord list, so we were able to print labels from our landlord list, and we sent them out from here at the Housing Authority, and the mayor's office are the ones who created the letter for us and printed it out and paid for postage. The next thing that we did was the mayor has a newsletter that goes out once a month with the city utility services, and so in November he followed up his talk show and wrote a newsletter about this task force to end veteran homelessness. And so this newsletter went out to every single household in the city of Pocatello that receives city utility services. And so the goal there again was to get landlords to help us by working with our program, but it was also very useful in helping us to identify more veterans, because based on that letter, we received a lot of phone calls from individuals who stated that they knew of a homeless veteran, and so we were able to increase our list of veterans that we needed to serve. So we feel like we've had great outcomes. Through our outreach efforts, we've had many landlords who have volunteered to participate in our program, and as I said, many have been willing to waive their fees. Our lease-up has been continuous. Those who work with our homeless veterans recognize that the lease-up number really is fluid. So an individual may come on our program 1 month, and within 3 or 4 months, they may be self-sufficient and go off of the program because they were able to reach stability more quickly than someone else. And so then that frees up that voucher for another household or individual to come onto the program. So to say that you're fully leased up with the VASH vouchers is really difficult because it is so fluid. But we do feel like we've got a really good system in place in order to continually have those vouchers issued and out on the street. Our mayor did declare functional zero in February of 2015. As was stated earlier, there is a tool that has a series of benchmarks, and I will state that our mayor chose to not fill out that entire tool. He was, quite frankly, just more interested in knowing that we had impacted our city and that the systems were in place. So once a veteran was identified, we were able to move them through that system quickly and get them so that their other issues could be worked on. So although we did declare functional zero, that has not been recognized by HUD. One of the other things that I will share in regards to what had previously been stated, someone had indicated, working with your housing authority to see if they'll create a homeless preference. And we actually did create the homeless preference here at my housing authority before this task force was even created. We created our homeless preference in October of 2013. We felt compelled to do more in our community in order to house individuals in the greatest need. One of the reasons I will kind of give you a heads up why housing authorities may not be interested in participating or creating a homeless preference is it's really difficult to administer. And we recognized that before we created it because we aren't a COC. And we don't have maybe those lists. And so when we look at it, everyone who comes into our office really can indicate that they're homeless, and we have no way of knowing if they are or not. And our waiting list for our voucher program is about 3 years. So what we did was we removed that qualifier from the housing authority. We are no longer the agency that states that this person is homelessness. We have them to be referred either from the homeless shelter or the domestic violence crisis center, indicating they're homeless. And so therefore, someone else who really deals with homeless populations all of the time and is in the know indicates that yes, this individual is homeless. And I will say that we have, since implementing that preference in October of 2013, we've housed 68 households. And that's incredible because when you look at what our point in time count is, again, it's reflective that there are more people that are homeless in Pocatello than are being captured on that point in time count. We do feel like we have been very successful. I do think it was in part because the mayor lent his name to our program, but it has since moved beyond the mayor's task force because of open meeting laws. He only convened us for 1 year, and so now we have been rolled into our homeless task force, our homeless coalition, as a task force part of that homeless coalition. So we're still working and meeting quarterly to ensure that we know the names of the individuals who are homeless, we know who's working with them, and that they have a path to end their homeless crisis. So if there are any questions, I'd be glad to answer those, but thank you for your time.
Thank you so much, Sunny, for your presentation. I know so many of the strategies that you used are just creative and wonderful, and I know, again, you can't see us, but everyone in the THN conference room is silently cheering for you. We think that what you've accomplished is fantastic, and we're hoping to take the lessons that we learned from Pocatello and be able to apply them everywhere across the BOS, so thank you for sharing that with us. I recognize that Sophia and I were a little bit more long-winded than we had planned. I just really love the sound of my own voice. And so we apologize that we're going to go a little bit over for our question and answer. If you have to go, of course, do that. But if you can stay to get your questions answered, we would love to answer them for you now. And we will be including the question and answer portion in the recording that we will distribute. So if you do have to go, there is a way for you to catch it in a couple of days. So now I'd like to introduce Kelly Barker. She's a senior analyst at Apt Associates, which is one of our technical assistance providers. In her position as a senior analyst, she provides technical assistance on HUD and VA programs focused on ending homelessness to diverse communities throughout the country. She is also the lead TA provider for HUD's Vets at Home initiative for the Texas Balance of State. And today she's going to help us with our Q&A segment. So go ahead and take it away.
Great. Hi, everyone. Well, thanks for having me. I don't think we shouldn't go too much over because it looks like there's only 2 questions that have been submitted so far. But just want to, we can run a little over. Like we said, this is recorded. So if anyone has questions, while everybody's still on the line, or the panelists and the guests, go ahead and shoot your question in through the question box on your control panel. Or you can raise your hand if you prefer to speak your question, and I can unmute you. So the 2 questions we have so far, the first one was submitted by Naomi Reynolds, and it addresses prevention assistance. So whoever wants to jump in, maybe Caitlin or whoever wants to address this. So the question is, do we have prevention assistance that can aid households in preserving their current housing situation? The homeless program helps the veterans who have 4 episodes of being homeless. Near homelessness has not been a key marker. This has caused many veterans to be on the street.
So that's a really great question. It's kind of a community-specific question because not all of our communities have the same access to resources. I will say the SSVF program does receive housing prevention or homelessness prevention dollars. Not housing prevention, that's the opposite of good. So you may be able to work with your SSVF program for those veterans that are eligible for SSVF. As far as the COC program goes, we don't currently get funds for homelessness prevention, but the Emergency Solutions Grant, or ESG, which many shelters receive across the balance of state, also has homelessness prevention dollars that your community may be able to utilize. And I'm not familiar with where you're coming from, Naomi, so I can't get too specific, but those are some general places where you may look. It's also possible that if you have a strong faith-based community in your area, that if they are willing to contribute some dollars to perhaps your local homeless coalition that could administrate your homelessness prevention assistance, so that could be another option that is not utilizing government resources that you could utilize.
Okay, great. The second question is also from Naomi. The question is, aftercare is huge. Veterans I've met are placed in housing without beds and furniture, referred to church and other organizations. We must come up with a method of aftercare. These veterans are back in the homelessness system as a result. What aftercare is available?
So that's another really great question, and it kind of depends on what program that the veteran used to get housed. So if the veteran went through SSVF, I know that they do pretty robust aftercare, so the case management continues after the rental assistance has stopped. They are also able to provide veterans with some basic household supplies up to a certain dollar amount. So that's a resource that you have at your disposal if your veteran went through the SSVF program. If they went through COC funding, it's the rapid rehousing program. I know that at least 6 months after the veteran exits from getting rental assistance, that case management is allowed for up to 6 months afterward. And it's very agency specific after that. Those are official funding sources that I know of. Cameron, do you want to weigh in on this?
Yeah, Naomi, I just wanted to state, one, I'd be concerned that a program housed a veteran and didn't assist them in finding things as basic as furniture in order to maintain that housing. So I think, when you're working in your community, and again, we don't know where that is, but we'd love to speak with you after the webinar at a different time. When you're working in your community and you develop this group or this task force focused on this, I think bringing up those issues and ensuring that programs are either able to provide those resources, or you as a group and community are finding other resources that can can step in and provide those resources. I know lots of communities work with furniture banks or have vouchers, through certain thrift stores, through churches, but I think, it's concerning to hear that a veteran was housed without having all those basic needs in place into the housing. Housing first is not housing someone in an apartment without any furniture or cookware or anything that they need to remain housed and maintain that housing. And to, so again, that's a little concerning, and we'd love to discuss that a little more thoroughly with you about your specific community and what some of these specific projects may be.
Great. Okay. It looks like there are no further questions. We'll get one last request. If anyone has questions, you can raise your hand or you can send those in. We'll go ahead and wrap it up. And I want to say, I just a few comments just to close things up, I definitely heard quite a few themes throughout all the presenters' comments, and I think there are themes that are echoed nationally, so just wanted to kind of highlight those 2 or 3 wrap-ups. You know, I think as Sophia mentioned earlier, I'm providing technical assistance for the balance of state as part of the Vets at Home initiative, which is a HUD-funded initiative around ending veterans' homelessness for communities that haven't received really any other technical assistance throughout the country. So I've worked with about, I think I have like about 7 communities that I'm working with. And I just want to say to, you know, Texas Balance of State is you're very unique in the country and just the vastness of your continuum and, but, you know, the large geography and the disparate nature of it. But, you know, so we know that it's going to take a lot of focused effort on behalf of everybody on this call, and then some, and determination to really reach the goal of functionally ending veterans homelessness. But the good news is that we know it's possible. I think at the last count, Cameron had told me before the call that 21 communities throughout the country in 2 states have reached this goal of bringing a functional end to veterans homelessness. So that includes small communities and large communities, you know, states and cities, urban and rural areas, all of them. The path has really been paved for you all. And so, you know, through these communities that have reached these goals, we really know the salient components that are critical to have in any strategy to reach these goals. So, you know, the path's been paved. We know what works. We've mentioned all of those components on the call today. You know, we've heard a lot of the same themes echoed several times by really each person. We didn't plan that, but we know that it requires strong leadership. You have strong leadership here, you know, at THN in your continuum, and I can tell you that it doesn't exist everywhere in all continuums. So you're very fortunate to have strong, smart, supportive leaders from a continuum level, but it also requires strong, smart, committed leadership on local levels throughout the continuum. So we're really, you know, kind of spearheading this with this webinar to ask you all to really step up to the plate and be leaders in your communities. Most of you probably already are, but to be a leader, I think it also requires you to forge new partnerships that maybe we've been able to kind of work around in the past, but now it's really, really critical to step up and really kind of forge these new partnerships and new collaborations. Some of them are going to be creative collaborations that maybe you've never thought of before. But really, you know, I think this webinar is asking you to kind of look at what are the barriers in your community to reaching these goals. Now that we have the goals clearly outlined, and then really brainstorm with your partners about who else needs to be at the plate to help address these barriers, break down these barriers, and what can you do to get these people at the plate. And this is where THN can really support you. So we know leadership matters. We know thinking creatively to address barriers matters, and this concept of hyper collaboration and partnership matters. And then finally, just setting these goals and really approaching them with a true sense of urgency is really critical, and that's what we found through all these communities that have reached these goals throughout the country. They approach this and tackle this with just the utmost sense of urgency and unrelenting commitment, and that's really what's going to get you at your goal. So we all know you're doing awesome work now, and you know, I think this webinar is asking you to even take it to the next level and kind of clearly outline what that'll look like. So you have a lot in your favor and a lot working for you. We're all here. All the panelists on this call today are all here to support you in all these different areas. So I'm really excited to continue to work with you all. There's a ton of resources out there to help get you started and to keep momentum going once you reach those goals, because I know you all will. So I think that's pretty much all I wanted to say. I want to thank everyone that joined the call today and thank all of your participation. I don't think we got any other questions, so I'll pass it back to, I don't know who at THN, Cameron, Sophia, Caitlin.
All of it.
Close it out?
Yeah.
Thank you, Kelly.
You're welcome.
Thanks very much. I just want to take a moment to thank all of our guests, Tammy, Robert, Kelly, for all of your support and Sunny for sharing your very specific story. I have notes here of things I want to get from you that you all used in Pocatello. And again, you know, like Kelly said, you're hearing the same things from us, and I'm not going to echo them all again, but there's a reason we're all saying the same things, because they're true. It can be done. It works. And again, we've got great support. That was clear on the call today. We already know that. And we want to be here to support you all. I know this was a lot to digest, and we know, again, it's not going to be easy on the ground, but really nothing ever doing is. So, you know, we're here to support you. I'm hopeful that all of you are so busy making notes and plans and texting and calling people right now, you just can't take a moment to ask us questions, but that you'll have them. And we'll still be here after this webinar. And please feel free to reach out. You've got Caitlin and Sophia's contact information. All of our contact information is easy to find on our website. We are here to support you in this urgent goal. You know, it's one of our main functions and goals as a COC as well. So we're looking forward to taking this journey with you all. We are thrilled to be doing it with the communities we're already working on it with. And just thank you all for your time. And we really look forward to hearing from you. And thanks again to our guests and to our staff here in the room and for all of their hard work. Hope you guys have a fantastic rest of the week, and we will talk to you soon.
Thank you.
Thank you.